Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole de la séance d'information de cet après-midi. Dr. Jennifer Russell, médecin hygiéniste en chef, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Good afternoon. Bon après-midi. Since the COVID-19 pandemic began, our focus has been on protecting our most vulnerable citizens, those least able to defend themselves from this disease. We have seen the devastating impact that this virus can have in nursing homes and long-term care facilities in other provinces. We took decisive measures to keep COVID-19 out of these facilities, which have caused hardship and heartache for many New Brunswick families. And we knew it could happen here as well. Now, in spite of our efforts, it has. Today, there are 3 new cases of COVID-19 in the province. These cases, and one reported yesterday, have all been confirmed in residents of the Manoir de Vallée long-term care facility in Atholville. All of the cases reported this weekend are directly related to the outbreak now underway in Zone 5, the Camelton-Restigouche area. The 3 new cases reported today are all individuals between the ages of 80 and 89. And there are 3 individuals with COVID-19 now in hospital, including one who is under intensive care. And so our thoughts are with them and their families right now. Yesterday, we processed 1,305 tests at the microbiology lab at the Georges Dumont Hospital Laboratory, by far one of our largest one-day volumes since the pandemic began. And I do want to offer my sincere gratitude to the staff there. They have been working very, very, very hard, many, many, many long hours to make that happen, as well as the teams who have actually done the testing at the centers up in Camelton and Dalhousie. So we have a huge team, including public health, including Vitalité, including EMP. There's a huge amount of people doing work behind the scenes to address this crisis right now.
Today, there are 2 new cases that have been confirmed in New Brunswick. 3 cases. These cases and those one reported yesterday have been confirmed in residents of the Manoir de la Vallée long-term care facility in Atholville. All the cases are reported this weekend are directly related to the outbreak underway in Zone 5, Camelton-Restigouche. The 3 new cases reported today are all individuals between the ages of 80 to 89. There are also 3 individuals with COVID-19 in hospital, including one who is under intensive care. And I want to say that our thoughts are with them and their families. Yesterday, we processed 1,305 tests at the microbiology lab at the Dr. Georges Dumont Medical Center, by far our largest one-day volume since the pandemic began. I want to offer my sincere gratitude to our laboratory technologists for their tireless efforts, as well as to our public health team and everyone behind the scenes who are working so hard to help us address this crisis. Certainly people at Vitality, people at the extramural program as well as social development.
Cases in the province, all in Zone 5. But there is a possibility that the virus could spread beyond that region because we know the incubation period is 14 days. So all of the people that we have tested so far who are close contacts of cases, those people are self-isolating at home for 14 days. And anybody who tested negative who has concerns, again, that doesn't mean that they can't become positive sometime in the next 14 days. So we have a 2-week period ahead of us where we're going to be watching very, very carefully what is happening in that region and also around the province, because we know that people have left that region since the time that there has been transmission of COVID-19. So again, every corner of the province needs to be vigilant. Watch for symptoms of COVID-19 in themselves and their families and friends. And please call 811 and get tested if you have 2 of the symptoms that we have on our list of symptoms. When we learned late last week that a healthcare worker who has been infected with the virus had worked in a long-term care facility, public health took immediate steps to determine its spread. All residents and staff were rapidly tested, and steps were taken within the home to isolate residents from one another. And again, because we know that we have found some positive test results at this point in time, the people who tested negative will continue to be isolated and monitored for the next 14 days. La santé publique et le programme extramural travaillent avec la direction de cet établissement.
Okay. Public Health and Extramural are working with the management of this home to coordinate clinical care for residents of the Manoir de Vallée. Additional staffing is being deployed there, including nurses, personal care workers, and cleaning staff. And the work of Extramural and other services are very important. And employees are using personal protective equipment and following all protocols in caring for the residents. And all sanitizing and cleaning measures are being taken as well. As well, there are other people who will be working in that area, Zone 5, other healthcare people, and I want to congratulate them because it takes courage and a lot of effort to do so. And I want to thank all the people working in that zone at this time.
For residents and staff of the Manoir and their families. An outbreak in a senior's home is everyone's greatest fear. Please be assured that our overriding priority is the health and safety of the residents and those who care for them. And I just want to speak about the broader situation in Region 5 at the moment. Again, I want to express the gratitude to all of the people living in the Restigouche area at this time. We had people coming out in great numbers. Again, I think over 2,000 people in total this weekend got tested. So our objective was to ensure that when we identified those who were currently involved in the community in the transmission of the virus and in the region, we really were looking very widely. But at this time, because we have tested over 2,000 citizens who did not have symptoms, there have been no positive test results in that particular set of group of tests. And so that means that for that particular snapshot in time, there are no positive tests in that particular group of people who were tested who did not have symptoms. So this provides us with a lot of confidence in terms of reducing the level of testing for the next week. So effective tomorrow, as of Monday, tomorrow, we're only going to be testing people who have 2 symptoms in our list of symptoms. And we won't be taking the walk-in tests in our assessment centers. So anybody who has symptoms will get tested. You have to call 811 to make that happen. And we will ensure that the focus will remain on those that are at the highest risk. And so those are the ones that we want to make sure that we test first, and those are the ones that are we want to make sure we can contain the outbreak. But again, we have 14 days ahead of us to watch for new cases to become apparent. So those people most closely involved in the situation really do need to watch for symptoms and stay at home as much as possible and reduce your number of close contacts. If you have been tested in recent days, remember that a negative test does not give you immunity, and you must continue to self-monitor for symptoms. It's important that everyone watch for symptoms and their families. You could test negative and then encounter the virus from another source. And if symptoms emerge, you have to isolate yourself and arrange to get tested again. All New Brunswickers must remain vigilant and work together to slow the spread in our province. And I understand that this causes a lot of anxiety and frustration. People would say, we've come so far, we've done so much work, we've achieved so much success, and now this. Well, this is part of the process. This is part of the 2-year process until we get a vaccine. So we have to be cognizant of the fact that we don't live on an island. We can't shut our borders completely. And as long as there are cases outside of our jurisdiction, we are always going to be at risk for more clusters and more outbreaks. We need to support each other. We need to help each other during this crisis. And, I know that people want to blame others, but really the blame is the virus. It's not the people, it's the virus. And we can't do any more than what we're doing right now in terms of trying to protect our population. It won't help slow the virus or end suffering if we are just angry about it. I think we have to focus on what we can do. What can we do to limit the spread of the virus? And how can we offer our support to those who it directly impacts? You can limit your close contact with people. You can physically distance with 6 feet between you and other people. You can wear a community face mask that covers your mouth and nose. You can wash your hands and avoid touching your face. And you can regularly disinfect your home and the surfaces in it. Les résidents de la zone 5.
Residents in Zone 5, especially those especially the residents and those who work at the Manoir de la Vallée need your help. You can show your support by taking measures that will limit the spread of the virus.
Many crises, World War I, Spanish flu, Great Depression, World War II, many, many other hardships have been endured over centuries. And what we have learned is that people are resilient, they have survived, and have coped with difficulties. With support, encouragement, donations, volunteerism, healthy coping strategies, feeding your mind and soul with positivity, social connection, culture, and arts, the ripple effects of acts of kindness are far-reaching, and humanity as a whole has a call to action right now. We have a lot of hurting people in this province, in this country, in our neighboring country, and in the world. And right now, this situation is far from perfect, but we are making the best decisions with the best evidence right now. And it is an evolving situation, and we're not just dealing with COVID-19. At the national level, we are having conversations about our goals and objectives moving forward in terms of looking at the unintended consequences and all of the other things that are happening separate from COVID-19. And because of all of this, now more than ever, we need compassion. So we also need good evidence-based information that we can share with you. So please follow us on Twitter. Please follow us on Facebook. Check on the GNB website regularly. I can't get out of bed in the morning every day and come to work without hope. So I do have hope for the future. I have hope in humanity, and I have hope in the citizens of New Brunswick. En travaillant ensemble, nous pouvons.
By working together, we can confront this challenge. Thank you.
This weekend, we are continuing to see an increase of new cases of COVID-19 in Zone 5, the Campbellton region. I know this is very concerning for all of us to hear this news, especially since today's 3 new cases are connected to Manoir de la Vallée, the long-term care facility in Atholville. This facility includes independent living apartments as well as a special care home. 51 people live in this facility, and so far the cases have been isolated to 1 unit with 18 residents in it. This doesn't just affect people who live in and around Campbellton. This impacts all of New Brunswickers. Mes pensées vont aux résidents et
My thoughts are with the residents and the frontline employees in this facility, as well as their families.
and I especially want to thank those employees who continue to work during this outbreak. I want to assure you that we are taking measures to ensure we provide the same level of protocols and protections for residents and workers in all of the long-term care homes in New Brunswick. Every decision we make is with the most vulnerable residents in mind. We have a huge team of people who are working tirelessly to contain the situation, and I want to express my gratitude to each and every one of them for going above and beyond. I want to join Dr. Russell in thanking the healthcare professionals and frontline workers, including extramural program employees in our long-term care facilities and who are working hard to care for these residents. I am grateful to all the people who have been working behind the scenes to set up additional testing sites, including extramural and Ambulance New Brunswick. The team at Campbellton Regional Laboratory, led by Mr. Yves Goudreau, has been rapidly testing and coordinating the delivery of an unprecedented amount of samples. They're working closely with the lab team at Georges Dumont Hospital in Moncton, which is led by microbiologist Dr. Louise Thibault. These professionals are all doing an incredible job and are working efficiently to process samples from Zone 5 and from the rest of the province. In fact, just yesterday, more than 1,300 tests were processed, which is the highest number we have processed in one day since the pandemic began. I also want to thank our partners in Vitality Health Network, as well as officials with the City of Campbellton and the town of Dalhousie, who have been extremely cooperative in working together with us to address this situation. So many New Brunswickers are doing great work right now at this moment to help contain this virus. Je ne veux pas que personne pense.
I don't want anyone to think this means New Brunswick is losing in our fight against COVID-19. We knew that this battle would span many days, weeks, and months.
And that will continue to be the situation until we have a treatment or vaccine, and it is widely available. What is important is that we are showing that we can deal with these situations quickly when they do occur. That is going to be critical moving forward. Aujourd'hui,
Today, more than ever, we must take the measures necessary to protect ourselves and those around us. This means we have to follow the guidance provided to us by public health. We must follow the rules set out in the emergency order.
engaging in activities that are permitted in our health zone currently recovery phase. Also, we need to make sure we have a mask with us whenever we leave the house. That's an important habit that everyone needs to start adopting. Whenever you leave home, you bring your keys, you bring your phone, you bring your wallet. Now it's time just to ensure you bring your mask. Just grab it on the way out the door. That way, anytime you find yourself in an indoor space, whether it's a grocery store or shared office space, where if the physical distancing is simply not possible, you can put on your mask. This is a simple step we can take to help protect everyone around us. As we continue to work through the highs and lows of this pandemic, we are doing so as a province. I want to assure the people of Campbellton that we are still in this together. And I want to encourage people in every part of this province to continue to take precautions. We need each and every one of you to continue to do your part. This is a little setback, but we will recover from this, and we will move forward as a province together. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci, Dr. Russell. Merci, Monsieur le Premier Ministre. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions de journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Kevin Bissett, Canadian Press.
Yeah, good afternoon. A question for Dr. Russell. Dr. Russell, what we've seen with other long-term care homes across the country is, in many cases, when we've had spread in there, it's been cases where there have been more than one resident per room. I'm wondering if you could sort of paint us a picture of Memoir de la Vallée as to, is there just one person per room? Have the people that have tested positive been removed from the home? Are others isolated? And has everybody been tested?
So, great questions, Kevin. The entire facility, in terms of the residents, have been tested. And as of right now, the people who have tested positive at this time, and we know there could be more people that become positive eventually, but the ones that are testing, that have tested positive at this time, are confined to one unit, in terms of that's where they were in the first place. A lot of the rooms are private. I don't have a map of the facility in terms of what is transpiring, but what I can tell you right now is there's only one unit right now that the patients have tested positive, and they are all isolated at this moment in time. And the staffing requirements right now, our extramural program has nursing staff and personal care worker staff that are helping out with the situation to make sure that all the staffing needs are met. And yeah, so the patients that have tested positive, all the patients are isolated to their rooms right now who can be.
Kevin, thank you, Doctor. Mr. Bissett, do you have a follow-up?
I do. Dr. Russell, again, I wonder if you could give us a little bit more detail in regards to the three people in hospital as to where they're from, their ages, that kind of thing.
Well, all the current active cases are all from Zone 5, and my understanding is there are 3 people hospitalized. One of them is in ICU at the moment. Was that the information that you were looking for?
Well, I'm wondering if any are from the nursing home.
I believe 1.
Thank you, Dr. Russell. Thank you, Mr. Bissett. Vicki Hogarth, Charlotte County TV.
Thank you. My question is for Dr. Russell. Dr. Russell, can the health authorities assure us that going forward, healthcare providers entering New Brunswick from other provinces to provide services will self-isolate for 2 weeks before they have contact with patients?
So the health authorities have a specific protocol for locums, and it involves work isolation and some testing. So that is with the health authorities right now, and again, they're constantly revising and relooking at that information to make sure that New Brunswickers are protected and staff and patients are protected.
Do you have a follow-up, Ms. Hogarth?
I do. It's for the Premier Higgs. Do you know if the healthcare worker responsible for the outbreak is being monitored to ensure that he is self-isolating?
Vicki, I'm going to answer that question, and if we could just come back to the investigative process for public health. We know that we can learn information with more contact tracing about how things came about, and what I will say is that the travel-related case that is contributing to the cases right now, all of the people who need to be self-isolated are being self-isolated at the moment in time. And again, I just want to make sure that people understand that we have to respect people's confidentiality in this situation, and that, again, more information can come to light around where these cases originated. But I can just tell you that the original case is a travel-related case, and all of the close contacts have been contacted. Everybody who needed to be tested has been tested, and all of the people that are needing to be self-isolated are being self-isolated.
Thank you.
Ms. Hogarth, do you have a follow-up?
Oh, I think I had both. Thank you.
Sorry. Trevor McNally, Campbellton Tribune.
This question is for Dr. Russell. Dr. Russell, I was at the COVID-19 test site at the Campbellton Regional Memorial Civic Center on Friday, and I saw one of the managers from the hospital being tested. That manager has since gone to work on Saturday. I just want to know what your comment would be regarding a manager within either of the 2 health networks after 2 months of a pandemic lockdown, not knowing that the hospital staff needs to self-isolate after their test, before their test results are known, or knowing this and telling his staff otherwise, that they need to report for work prior to knowing their test results.
Well, where somebody works or doesn't work was not specified with respect to offering asymptomatic testing to the population of Zone 5. So anybody who is connected to cases with respect to direct contact, those people would have been told to self-isolate. So what I can tell you is that the people associated as being identified as close contacts of the cases would be self-isolating right now. And the asymptomatic testing that was offered to the people of Zone 5 would be independent of where they worked, and they would probably have been told to self-monitor if they weren't direct contacts in terms of being contacted by public health. So public health would be providing all that information to people. And so again, right now, anybody who was a close contact is isolating at home for 14 days, regardless of whether they were tested or not. And again, that's why it's so important for everybody who was tested, whether they had symptoms or not symptoms, to continue to symptom watch, because again, if you were contacted directly by public health as a close contact, you're self-isolating at home currently.
Mr. McNally, do you have a follow-up today?
I do, for the Premier, please. With hundreds of people having been in contact with the 2 doctors at the Campbellton Regional Hospital, should the province not set up checkpoints at each end of Zone 5 to minimize chances of COVID-19 spreading to other areas of the province? Yeah. And at what point in this cluster situation would the province consider going back to the original state of emergency and having Zone 5 locked down completely to avoid additional spreading within the zone itself?
So public health has been very much involved in deciding what should happen with respect to the outbreak response in terms of what needs to be done to protect the public. So our recommendation was to advise the public that non-essential travel was not recommended in and out of that zone currently. And so we will maintain that advice. There is no need for public safety to be involved at this moment in time, in the sense that we are trusting that people will take that advice. We know that some people will not take that advice, but again, our recommendation was really around allowing public health to do the best work possible with the information they have right now and the staff and resources they had to do testing and contact tracing at this moment in time, because that is the most critical piece of work that can be done. So whether people travel in or out of that zone for non-essential purposes, obviously we're discouraging that. We strongly recommend that people don't do that. And obviously it makes people worry in other situations in other areas of the province right now. So we know that it is concerning other residents around the province if they were to see people traveling for what they perceived to be non-essential travel. So if those people are doing that, it's obviously discouraged. And for those people who are anxious and worried about that situation in the other areas of the province, the steps that they can take to protect themselves are the same ones that I have been saying throughout the pandemic. Please wear a facial mask. Please stay 6 feet apart from other people. Again, limit your interactions with others and the time that you spend with others, especially indoors. And we are going to be testing the long-term care facilities in Zone 5 later this week.
Thank you, Mr. McNally. Silas Brown, Global TV.
Hi, Dr. Russell. You mentioned that all staff and all residents of the care home have been tested. But will there be additional testing happening moving forward to really keep a close eye on the situation in this home?
I confirmed that all the residents had been tested, and as many staff that had been working there as possible have been tested. Moving forward, as of right now, the testing plan is to test other nursing homes in Zone 5 later this week. At this moment in time, we are going to continue to symptom watch in the current facility as of right now. And again, the people that have tested positive are self-isolating in the one unit, and all the other clients that can be self-isolated are being self-isolated right now.
Mr. Brown.
And it is not a nursing home currently, it's an adult residential facility, is my understanding.
Mr. Brown, do you have a follow-up?
Yes, you mentioned that some other homes in Zone 5 will be tested. Are there any that you're particularly concerned about that may be connected by a direct link to any current confirmed cases?
Well, again, we are basing our information on the test results that we've received as of right now, and all the test results that have come back, the close contacts are being contacted and tested. So what we're just doing out of an abundance of caution is just to make sure that those residents are tested this week out of an abundance of caution.
Thank you, Mr. Brown. David Caron, l'Acadie Nouvelle.
Yes, hello. Hello, go ahead. Yes, I think my question would be to Jennifer Russell, Dr. Russell, sorry. I was wondering what it means for the emergency services at the Campbellton Hospital if the closure is going to be maintained, or if citizens, if they will be able to go back this week. When do you think the emergency room will be reopened? At this point, it will stay closed, but discussions are continuing with Vitality to have more health workers, but I don't know how long it's going to remain closed. But I know that in planning at this time, we want to have more healthcare workers to work at the emergency department, but I can't tell you how long the closure will last. Okay, Mr. Caron, do you have a follow-up this afternoon? Yes. Okay, so on the same topic, I'm wondering to what point can we trust that the closer hospital, Bathurst, would be able to take in extra patients? Well, when it comes to seeing patients and seeing them treated at other hospitals, it really depends on the capacity. I mean, it depends on human resources and the number of available beds. But these are discussions, we're having discussions with the Vitality, and they have a plan to make sure that the people will get health care services, whether it's in Bathurst or wherever, if necessary. But right now, it's not a problem. But just in case, there are talks taking place to plan this. Thank you, Mr. Caron. Radio-Canada. Hello. Thank you, Bruce. My question is for Dr. Russell. You spoke about having extra staff to be sent there. Can you tell us how many have been sent to the manoir? And and how many people are there as well? The only thing I heard was how much staff will be sent to the manoir. Is that what you're saying? Yes, and how many are already there? Okay, that's a part I don't quite understand. I don't hear you. Okay, can you speak a little louder? I mean, how many people have already started working there? Most of the staff that we need to work there have already been deployed. They're already there. And if we need more, they will be deployed as well. And this is under the leadership of the extramural program. And it comes from that program. They're working closely with public health. So extramural and public health are working together to make sure that all staff needed will be working. As well, Vitality is involved as well. Thank you. Do you have a follow-up question? Yes, I do. I would like to know, Dr. Wassel, what is the situation for 811? You talked about a number of tests that went up, so what is it looking like at this time? You'd like to know if the capacity is there for 811? Yes. 811 receives many calls, not just for screening or testing, but also for information. So at this time, I couldn't tell you how long people have to wait. But right this time, the people for whom there is priority for tests are people who are sent there by public health to be tested and who are linked to the current spread. But anybody, wherever in the province, who have two symptoms can be tested, and they will receive those calls. And I believe that 381 calls have been received by the nurses there, or from nurses. 283 were referred for testing. Thank you, Mrs. Paul. Thank you, Doctor.
Hi, this question is for the Premier. So there are suggestions that some employees at the care facility have resigned. What is the status of the workforce in that care home?
I think as Dr. Russell described, we've had the extramural have stepped up to take up any concerns about reduced staffing. And yes, there is some reduced staffing there at this point, I think about 30% or so. But at this stage, extramural have filled in. Certainly the Amherst, New Brunswick paramedics have filled in, and there are volunteers coming in the area as well. So it's well staffed. There aren't any concerns in that regard, and the unit's well isolated, which is I guess a good hopeful sign. And I guess as was emphasized before, this is a long-term care facility, special care home, not a nursing home. So we feel like it's well contained at this point with adequate staffing.
Ms. Morin, do you have a follow-up?
Yes, I do. Does the long-term care facility have enough staff and resources to assist the healthcare facility?
Yes, it does. And they're also taking extra measures for cleaning. There's adequate supplies. I think it's important to recognize that, we've been planning and ready. The public health's been planning, health's been planning. That there's been a readiness should a localized concern rise, and that's what we see here. So I know that it's been certainly a SWAT squad that's moved in to do extensive amount of testing, and we've talked about that earlier. Many people have stayed at the facility, so I think it's important to recognize the diligence that they've offered, the dedication that they've offered to be there when they're needed the most. And that's what it takes through this whole pandemic. It takes, the little extra effort at a time when it's needed the most. And this is what we're in right now in the Campbellton region. And it's, of course, what we're in across the province. I know this past few days and the weather being as nice as it was, we've seen some pictures that would not have respected the social distancing. This example in Campbellton is clear that we are not out of this. We won't be out of it until there's a vaccine. So let's not be confused about New Brunswick being an island unto itself. This is a travel-related issue. It is well understood. The public health and the volunteers and health professionals around the province are doing a great work, concentrating in the north and the Campbellton region right now to track it. But it is here in New Brunswick. And we will be able to continue to open up only if we understand clearly the extent of which this has moved and that we can contain it. And I'm optimistic thus far that we will indeed be able to do that.
Thank you, Premier. Thank you, Ms. Morin. Bobby Terrien, l'Info Weekend.
Thank you. Welcome. My question is for Mr. Higgs. It's based on what he said last Tuesday. You commented that the federal government want to assess the possibility of allowing some meetings of some reunions of family members for people who have to cross the international border. Is this something that you would consider to allow family members to meet, but from people from other provinces, for example, Quebec?
It's clear that the extent of this discussion that we had last week with the Prime Minister and then later with the Deputy Prime Minister, what we spoke of was basically that it would be families that connecting and coming to stay and meet the quarantine requirements. So it wasn't a case of meeting at the border or meeting on one side or the other for lunch or a couple days or an afternoon. It was a case of where someone would come, they would be in a position to isolate at their family member's home and meet all of the current quarantine requirements. So that was what was suggested by the federal government. In my discussion with Deputy Prime Minister, it was basically, okay, how does this process work? How do we understand who they are, where they're coming from, where they're going to stay, and how they can follow the public health rules? So it's early in the discussions, but it was brought forward by the federal government in our call last Thursday evening, and I expressed concerns in that regard, and those concerns were quickly followed up by Deputy Prime Minister Freeland. And so now it's a case of working out what does it look like. So before we can move forward, either in any direction, we'll understand the rules, the regulations, discuss it with public health, and see if it makes sense or doesn't make sense.
Thank you, Premier. Monsieur Terrien, as-tu suivi cet après-midi?
Oui, c'est juste une précision.
Yes, just a specification if possible. You commented on the Canada-American side. What I'd like to know is, are you open to having this between provinces, so people from other provinces coming to New Brunswick in the same circumstances?
that this would entail, as we've talked with public health and we've talked with other provinces about, can we open up or can we bubble with other provinces in Atlantic Canada? If we're moving people from other parts of the country, I think we're going to get increasing pressure to do so, but it is pressure that can only be recognized if there is all the rules can be followed. So at this point in time, our borders will remain strong. I mean, we will continue the due diligence and even heighten that to understand who's crossing and why, and they're following the protocol. Any changes to that would not be forthcoming in the next week or two or three. I would say that, we're going to have to see things not only improve in the north, but we're going to have to see stability throughout the province. And then that discussion will happen with other provinces, public health across the country and other provinces, and make those decisions. If it changes with the U.S., I mean, one would I guess, quickly get to the position that how can we allow friends and relatives from the U.S. come to Canada under an express formula, but you couldn't allow people from your own country to do so. So it certainly will beg the broader question, should we move forward?
Merci, M. Therrien. Merci, M. le Premier ministre. Savannah Odd, Telegraph Journal.
Hi there. My first question is for Dr. Russell. I'm just wondering if you're able to confirm the total number of cases related just to the Manoir de la Palais home, residents and employees. And do we know, you mentioned on Friday, we don't know whether the healthcare worker that tested positive that had exposure in a home was working in several facilities. Do we know that piece yet? Do we know, I guess, if their work was limited to that one home? Thank you.
Yeah, so there are 5 cases related to the manoir. 1 is a staff and 4 are residents. My understanding is that staff person did not work in any other nursing homes or long-term care facilities or adult residential facilities. That's the information that I have today.
Thank you, Dr. Ms. Odd. Do you have a follow-up?
I do. Thank you, Bruce. For the Premier, I spoke with a city councillor from Ontario today who traveled to New Brunswick recently because he wanted to see our recovery process firsthand and apply that to businesses in his municipality, I guess, any learnings that he could see from that. He was allowed to come in through the border for that reason. So I'm just wondering if you feel that is something that falls under essential travel, visiting to see our recovery process, and why this person was allowed to leave our province again after 10 days when the mandatory isolation on entry is 14 days.
What I can say about that right now is it's under full investigation because it does not seem like a legitimate reason to come into the province. And so we will evaluate just what questions were asked, but more importantly, what answers were given.
Thank you, Ms. Ott. Thank you, Premier. Harry Forrestal, CBC.
Thank you very much. This is a question for the Premier. Premier, you mentioned that 30% of staff at the Manoir de la Vallée home had left their jobs. Can you tell me what real number that represents, how many people, and what you know about the reasons for them leaving?
10 out of 28. And they felt it necessary to leave the facility, which is concerning because, at a time like this, it's important that, we have everyone there to do what we can. And if they had a health risk, certainly it's important that we provide all of the necessary tools and equipment and to make sure that they can do their job safely. But nevertheless, I think it's important also now to recognize that we have adequate staffing. I mean, certainly extramural have stepped up to the plate. So is the additional workers, the 18 that are still there, as well as Ambulance New Brunswick. So we're not concerned about understaffing at all. More people will be brought in. I believe Dr. Russell referred to that earlier. And we can certainly ensure that all the protocols are being followed at this facility or any others for that matter.
Thank you, Premier. Mr. Forrestal, do you have a follow-up today?
Yes, I do. Does the departure of 30% of the staff, 10 out of that number, concern you in terms of what it says about their level of confidence in the care being provided there? And do you know anything about a date for the last time that facility was inspected by provincial officials?
I can't speak of the date in terms of provincial inspection. I don't know that particular information. But in relation to, is it concerning that 10 individuals felt it necessary to leave? Sure it is. When in a condition like this, in a facility, when it becomes difficult, that's a time when, you do count on people the most. But I think what's important here now is that because of this, Extramural have taken control of clinical care in that facility, and we're not concerned about our level of ability to operate and run that. But it will be interesting to kind of understand the concern that the employees had and why they felt it necessary to leave, because I guess you can imagine that if that happened in widespread numbers, it would create great difficulty within our system.
Thank you, Premier. Thank you, Mr. Forstall. That concludes today's update. Thank you very much. Cela conclut la séance d'aujourd'hui. Merci beaucoup.